Here we go. Oops. All right, let me set it to slideshow. Okay, does that work? Everyone can see them? Okay, wonderful. So I'm going to speak about designing educational interventions using best practices, which is really just about developing your curriculum, right? Developing your educational innovation, which you will ultimately write up and submit to EdMedEd portal. So the learning objectives for this session are to identify educational projects that have high scholarship potential to really help you as you start to develop and implement your own ideas, really have that eye towards scholarship and publication and make sure that your curriculum or your educational project really aligns with sort of expectations for what has a good potential for publication. The second objective is to really list the steps of backward design curriculum development. We'll actually go through a few frameworks for curriculum development, but I really want you to understand backward design development. One, because it's very easy, and two, because it really is just a very efficient and effective way to think about curriculum design. And then lastly, to describe some applied frameworks for learner assessment and evaluation, because as you'll see in backward design curriculum development, assessments are an incredibly important part of the curriculum development piece. Oops. So let me move forward. Okay, so just a show of hands, maybe, how many of you already have a project in mind, like a project proposal in mind? You know exactly what you're going to be doing. Anyone? Okay, so I don't really see any hands. I can't see a lot while I'm here, but that's fine. I think this is the fun part. So this is really about sort of brainstorming and taking your interests, your passions, and then turning it into curriculum. So I think, over the next 2 days, you'll learn a lot of nuts and bolts about sort of how to do this. But I think the most fun part is really recognizing that this project, this whole fellowship is a chance for you to develop curriculum and something that you care deeply about. So first, I would encourage you to just think about like what your interests are. These are all medical education projects, so we can think about really like clinical topics that impact health. And that is incredibly broad. You might be thinking about health for particular populations of patients, health for particular conditions, really the gamut. But what is interesting to you? What do you care about? What keeps you awake at night? What do you feel there's a great need to address? And then the second sort of brainstorming idea is more about process. So who are you interested in teaching, right? Who are you interested in developing this curriculum for? What kind of teaching methods are you familiar with, or do you prefer as a learner yourself? And maybe what other teaching methods are you interested in improving? So in curriculum, there's really like the content, but there's also the process. And sometimes, taking a very bread and butter topic, but implementing a curriculum in it with a new instructional design, teaching it in a different way, can be extremely innovative and effective. So I think when you're thinking about sort of these projects, think not only about the topic, but also how you might want to teach it. So use those ideas as brainstorming. So actually, if all of you have like a pen and paper, there are a couple of like just, exercises to work through. But the first one is if you can take that sort of brainstorming idea about content and process, what excites you, who excites you as learners, what kind of instructional methods are you interested in, just take a minute and use those ideas to just complete this sentence. I want to teach blank. So that's your learners about blank, your content, so I can improve blank. Again, what is the condition or the issue that you're trying to address? So just take a minute and write down your sentence. And you don't have to commit to making a project in this. This is just a brainstorming exercise. I'm just going to stop sharing. And if anyone feels bold enough to want to share their sentence in the chat or just say it out loud, that's great. So I can use an example, which I'll get back to at the end of my session here. When I worked as one of the fellowship leaders a few years ago. So one of the fellows was very interested in teaching students and health professionals, including trainees, residents, and attending physicians, about ableism, about biases, favoring those without disabilities, because she wanted to improve or sort of reduce disparities in health for patients with disabilities, of whom make up about 25% of the adult population. So that was sort of her idea and her passion, and I'll show you how she was able to generate that into a successful project. So what I'm going to dive into now is really the nuts and bolts about how you take that idea, that blue sky idea, that thing you're interested in, and turn it actually into curriculum. And I think, I think JP probably mentioned this at the very start, but all of what we're doing here is really trying to make things count twice. We're obviously trying to help you develop curriculum that you can implement to address gaps in knowledge, but we're also trying to work to help you turn this into successful scholarship, into a successful MedEd portal publication. So I'm going to use sort of that eye of MedEd portal to help you think through how you can turn that like blue sky idea, that sentence that you may have just jotted, into an actual curriculum. So there are a couple of frameworks for thinking about curriculum development. This one is called the 6-step approach, and it was developed by David Kern. And this was one of the very first textbooks I ever read on curriculum development. And just, as a side note, I do serve as a curriculum dean now at a medical school. I never knew as a med student or even as a resident that would be my ultimate profession. I was just really interested in teaching and learning. This book and David Kern's 6-step curriculum book was really like one of my first guides towards really thinking about curriculum development in a systematic way. So I think it's still a very useful book. But his approach that he has here identifies 6 steps for how you develop curriculum. And just briefly, I'll go into them in detail later on, because you'll see that a lot of these elements are sort of used in other frameworks. You start with that needs assessment, right? Identifying the problem. What is that thing that keeps you up at night? What do you care about? Doing a sort of global needs assessment, like what is the healthcare problem? How is it currently approached? What are the gaps there? And then doing a targeted assessment, needs assessment with your learners. So again, thinking about who is your target audience, who are you developing this curriculum for, and what do they need specifically with regards to this larger health problem that you're trying to address. The third step in the Kern model is then to sort of articulate specific goals and specific measurable objectives. And we'll spend some more time talking about how to develop those objectives. Then you move on to developing educational strategy, which is really like the curriculum itself. What are you going to teach? How are you going to teach it? You implement it, and then very importantly, you evaluate it, right? So you evaluate the individual learners. Did they actually meet the learning objectives? And you evaluate your curriculum. Did it succeed in your overall aims? So that's Kern's 6-step model. Oh, and you can see here, some of these slides are attributed to Dr. Grace Wong, who's a editor-in-chief of MedEd Portal, who had delivered versions of this talk before. So I'm grateful for the use of some of her slides. And then Dr. Huang took that 6-step model and modified it into these 5 steps, which still sort of address, I think, the main elements in Kern's model, but are really sort of written in a way that is tailored to the MedEd Portal submissions. So again, you start with that needs assessment. What is the problem? Identifying, articulating that. Then you define your goals and objectives. Well, what is your educational innovation going to do? So what are those goals and objectives going to be? There's identifying the resources. What do you have to work with, right? And some of these are sort of just material resources, like if you're going to, are you going to, first of all, are you going to have like paper cases? Are you going to have online cases? You have the tech support to develop online, materials. Some of this is going to be really human capital, like faculty, like how much faculty will you need? What kind of training may they require? So just identifying the resources is actually a very important part of the curriculum development. Then you're going to develop and implement the strategies themselves. So that is, again, the sort of instructional, what you're going to teach and how you're going to teach it, the content and the design. Then, of course, the evaluation is a really important piece. And please, I mean to make this like pretty casual. So if you have any questions, I can't see everybody. So just chime in. I don't think I can really see the chat easily either. So feel free to just speak up. Okay. So that's Huang's model. And now this is backward design. And backward design basically is a really dominant framework in terms of developing curriculum today. And the whole point of it is starting with the end in mind. So you start with identifying, articulating like what you want to achieve. So what is your desired result? What do you want your learners to do? Or what do you want to, what do you want, problem do you want to solve? How do you want to solve it? Then the second step, which is different from the way that Kern and Huang's model sort of lay out the steps, is to then think about what the acceptable evidence is going to be. By this, I mean, how are you going to know that you identified your desired result? If you want to increase medical students' comfort with caring for patients with disabilities, if you want medical students to address biases around ableism in their own practices, how are you going to know that that's going to happen, right? That might be your desired result, but you really need to sort of articulate what the assessments are going to be to show that the learners have actually met your learning objectives. So that is step number 2. And then step number 3, after you've developed the assessments, then you can plan the experiences instruction. Then you'd figure out, okay, what is the content that's going to help the learners meet their objectives? And what is the best way to teach it, the best instructional design to help the learners meet their objectives? So what I've done here is I've just basically merged Huang's framework with backwards design. I think that they can very much be accomplished together. I think Grace Huang's 5-step framework really outlines the really important features that you have to think about when you're developing your curriculum. And I've just sort of categorized them along the 3 steps of backward design. So again, first, starting with the end in mind, is what do you want to accomplish? Well, first you have to identify like what is the problem you're trying to solve, right? And trying to address. And so that will be your needs assessment. And we'll talk about that in a second. It's about defining your goals and objectives. So again, starting with what you want the learners to get out of your educational session. Then second will be determining the acceptable evidence, which is developing the assessments. Again, Kern and Huang's model kind of put it at the end of the circle, or cycle, but in the backwards design, it's critically important that you develop and think about your assessments right after you have your learning objectives. And then third is about planning and implementing your learning experiences. So that is about identifying what resources you have to work with. Sometimes, sometimes we're in resource limited environments, and sometimes that is going to sort of dictate what we want to do. So I would say not necessarily to do it in the order. You want to think about first like the best strategies and to meet your learning objectives, but sometimes you're going to be limited by the resources that you have at hand. So you kind of have to think about this together. And then ultimately you're going to implement your curriculum, and then you're going to evaluate it. You're going to roll out your assessments for the learners to see if and how they met your learning objectives. And you'll also want to include some evaluation piece to see about your curriculum, right? And that's getting learner feedback on the actual delivery of your curriculum. Okay, so I want to sort of do a deeper dive into these 3 steps. So the first one, again, is identifying those desired results, which has 2 components. And the first one is that needs assessment. So again, problem identification. What do you care about? Is it actually a problem? My student was really interested in studying ableism and dismantling that, in healthcare. So is that actually a problem, and why so? So she needed to articulate that. The stakeholder identification, who is this a problem for, right? So it's obviously a problem. I'm using my example of a curriculum about addressing ableism in healthcare. We were thinking about patients, obviously, but we were also thinking about trainees. We were thinking about trainees without disabilities and trainees with disabilities even, and how are they impacted in the sort of culture and structure of healthcare in America. Your needs assessment is always going to require you to look at what's already in the literature, right? We're not working in a silo. We have to connect our work to what has already been out there. So the literature review is going to be incredibly important. Help you get a better sense of like the scope of the problem you're trying to address and what's been done already and if it's effective or not. So that's where the systematic data collection piece comes in. What has already been done to address a problem that you also want to address? How effective is it? And that will help you identify ways to tailor your educational project to create something that's new and builds upon the existing literature. So again, as you think about or do this needs assessment, you're also simultaneously thinking about whether or not it's going to have a great potential for being published, right? So does it address an important need? These are things that reviewers will always look at when they're reviewing MedEd portal submissions or really any kind of journal article, a manuscript. Does it address an important need? Does it fill a gap in the literature, right? So is it something novel, something that hasn't been done already or hasn't been done in that way? And then lastly, is it generalizable, right? Because the whole purpose of scholarship is to disseminate knowledge, to disseminate best practices. So they're going to want to see, and you're going to want to think about whether your educational intervention can really be replicated at institutions outside of your own. Oops. Okay. So after you've done that needs assessment, I think it will help you sort of clarify the scope, what you want to focus, and it will then help you articulate your goal, right? So you have your problem and your goal is really going to be towards addressing that problem. And again, if you look at that sort of first sentence that I asked you to write in that early exercise, if you think about like what problem you were trying to solve or to what end, like I think you can see that there's probably a goal in there somewhere, right? Are you trying to improve for my learner, she was really trying to improve health disparities for patients with disabilities and for providers with disabilities as well. So the goals are broad and they reflect your overall purpose. They're kind of like your North Star for your project. I think they're incredibly important to articulate and write down. So I would encourage all of you as you think about, go through this exercise and ultimately develop your projects, think about your goal and always have that goal in mind. But the objectives are going to be incredibly important because the objectives are what you're going to base your curriculum and your assessments on. So objectives are specific, precise statements that describe exactly what your learners should be able to do after you develop, after they go through your curriculum. So the objectives should be SMART, and I'm sure most of you have heard about those SMART goals or writing SMART objectives, but this is incredibly important. So again, SMART objectives are specific, measurable, achievable, relevant, and time-bound. And the more you sort of are able to match all of these characteristics for their SMART goals, like within your objectives, the more likely your learners will actually be able to meet them. So let's go through some examples here. So there's an example of a SMART objective and maybe a less SMART objective, right? So the one on top, understand the health disparities of patients with breast cancer. It's certainly important, right? I would say that it is important and meets an important health need. But when you think about whether it's actually any of these 5 qualities down below, I mean, on the left of the screen, you find that it's a little bit vague, right? So understand is a word that we see a lot for learning objectives, but it's very hard to measure what understand is, right? It's hard to measure that and not terribly specific. Is it achievable? Well, I don't know. I mean, to what degree do you want your learner to understand health disparities, right? Is it relevant? It certainly may be relevant to your problem that you've identified. And is it time bound? Well, it doesn't say so in the sentence above. So if you compare that to the learning objective below, by the end of this activity, participants will be able to cite disparities in breast cancer prevalence and outcomes. You can see that it's far more specific It's measurable. You can certainly think of some way. Is there some way that you can, like, that your learners can demonstrate that they can do this? And you can imagine sort of thinking about ways that they can actually cite the disparities in breast cancer prevalence. So I think it's certainly achievable. And it is likewise relevant to your topic at hand, or your overall problem that you're trying to address. And then time bound, sort of by the end of this activity. So these are sort of features that you can see within this statement on the bottom. Are you guys familiar with Bloom's taxonomy? Yes. Okay, great. So this is a nice way to think about sort of like the pyramid or the hierarchy of objectives, right? The ones at the bottom tend to be quite basic. It's really about recall of facts and basic concepts, about sort of recalling information. And then as you move up, it gets far more complex. So then there's understanding, but if you want to be specific about what you mean by understanding, it's sort of taking that information and organizing it in ways. So discussing, describing it, explaining it, and then going up to applying, analyzing, evaluating, and then ultimately creating. So on the right are some nice examples about some verbs that match each of these different levels in Bloom's taxonomy. And you'll see as you think about your curriculum and you think about what your objectives are going to be for your learners, it's far easier to develop a curriculum that sort of addresses some of the more basic levels in Bloom's taxonomy, right? So recalling facts, sort of something that's very sort of knowledge-based, is something that can be pretty easy to develop and implement. Whereas if you are trying to create a curriculum that's going to allow your learner to then construct or develop something on their own, it may be more complicated. So I always like when I'm thinking about objectives and I'm working with my course directors and faculty about, developing their course learning objectives, I really try to get them to be very specific with their verbs. So I think this is a place where language really matters. Okay, so going back, if you have your sentence, I would love for you to indulge me with this exercise. Go back to your first sentence, which was pretty general, and I asked you to make it so. And think about whether you might be able to generate at least one SMART learning objective related to that project goal. So you can take a minute to just write that down. Great. Does anyone have any questions? Do they want to share their learning objective, or do they have questions about their learning objective? Okay, then I'll continue. So now you've completed step one, which is really thinking about the end in mind, right? So identifying like, what are your objectives? Like, what's your problem? What do you want to accomplish through your curriculum? The second step is really about developing those assessments, right? Determining the acceptable evidence. So the assessments prove that your learner has met the learning objectives. And it's really important that you develop the assessments before you jump into writing the content, because everything has to come and align with your learning objectives, right? You want to make sure that everything is aligned. Too often, faculty will come and say, I'm really interested in teaching about disability in patients and healthcare and health disparities. And I'd say, okay, great. And so then they'll come and sort of think about, things they want to discuss and whatnot, but they'll never really frame it as an objective. And then they'll try to sort of come up with some assessment, but they're really missing this link. They've not really articulated what the objective, like what do they really want their learner to get out of it? And then, and they haven't really developed an assessment. If you think about the objectives first, build your assessments, and then focus on your content and instructional design, that teaching session will be far more efficient and effective than if you don't do it. Okay, so again, sometimes we have people really excited because they want to bring in a guest speaker, who wants to talk about a topic that they're very passionate about, and that's all well and good. But you really want to make sure, again, that they're gonna clearly identify your learning objectives, that that's aligned with what you want to get out of it, and that there is, again, if you want to prove that your learners have actually met the learning objectives, that you're going to have some assessment to back that up. So this is just another scheme. I cannot emphasize this enough, right? The learning objectives are that from which everything else flows. So learning objectives must be articulated first, then you develop your assessments, and then you develop your instructional content and design. I'm working right now at Columbia. We're doing a big curriculum overhaul, really a revision of our entire 4-year curriculum. And everybody is really jumping to think about the content, right? They want to know, like, what are we going to teach? How are we going to, like, I want to teach about climate health. We want to make sure there's carceral care, like all of these fabulous topics. But what we've had to do is slow ourselves down and say, okay, but what are the overall objectives for our program? Like, what do we want our graduates to come away with regards to sort of broad, knowledge, skills, and attitudes? How are we going to know that they've like met those competencies, right, or those objectives? And then we can think about the content, the specifics, and how we're going to teach it to support the overall learning objectives. So we have had to slow ourselves down by really thinking about assessments before jumping to content and design. And I think the content and design part is like the sexy part of curriculum development, and assessments less so, but I would really implore you to slow down and follow the backward design model as you create your own curriculum. Okay, so thinking about assessments, and I think a lot of this, is really intuitive or at least familiar with you, to you. If and some of the others I'm going to show may be terms that you're not familiar with, but I think you're all familiar with these concepts, right? So when we think about assessments, like how do you know the learners have met your objectives? Well, you can think about this like KSA, the knowledge, skills, attitude framework. Like, is your learning objective that they acquired some sort of knowledge, and if so, what's the best way to demonstrate that, right? So that might be like a multiple choice question, examination or something like that, a written exam. If it's skills that you want your learners to obtain, you want to match an assessment that's going to demonstrate that. So then a multiple choice exam may not be the right assessment, right? But maybe an OSCE would be, or some sort of simulation activity where you can actually observe them performing the skills. And then for attitudes, if you want to change attitudes, if you want to increase comfort, confidence, change the way people perceive things, then surveys might be really appropriate assessment tools. So these are just some examples of, matching the assessment to the objective. Kirkpatrick's pyramid, are you familiar with that? That's another really common framework, right, in medical education, which thinks about, again, sort of what are you targeting in terms of your assessment? Are you looking at what is the intention of your educational activity? What's the intention of your curriculum? And then how are you going to demonstrate that through a specific type of assessment? So again, the ones at the bottom tend to be much easier to demonstrate, and the ones at the top tend to be more difficult. So perceptions, again, attitudes, comfort level, confidence, those are pretty straightforward, right? So surveys can be very helpful there. Learning, if you want to show, again, that your learner has acquired new knowledge, new skills, you may need an exam of some sort. I'm using in my examples here breast cancer screening, sort of getting learners or physicians to increase their use of breast cancer screening guidelines. So some of the learning pieces in the Kirkpatrick's pyramid may just be teaching them about what the common guidelines are for breast cancer screening, when to screen, whom to screen, who may be high risk, and then you can assess that certainly through an exam, for example. Behavior changes when you actually want the learner to change what they do. And so that may be something like assessed by actually observing the learner counseling a patient about breast cancer screening. So you can see that like it's definitely more impactful as you go above the higher up on the pyramid, but definitely harder to perform. And then finally, impact. Well, most of what we're thinking about is really health. So if we wanted to think about how we would know that our curriculum had an impact, well, could we prove that our session actually reduced breast cancer mortality, actually had clinical outcomes? And as you can imagine, that would be very hard to do, right? To sort of link one educational activity to a specific clinical outcome. But that is certainly at the pinnacle of the pyramid. So it's helpful to think about this, and again, and you want to try to be as impactful as possible with your curriculum, but you also have to be realistic about, about what you can accomplish through your curriculum as well. And what I would say is that particularly for MedEd Portal, for any kind of publication, obviously the higher up you can go in Kirkpatrick's pyramid, the more evidence you can have that shows sort of higher level changes are going to be sort of more have a greater potential of getting published. That being said, if you look at MedEd Portal, there are a lot of publications and that focus on sort of level 1 on changing perceptions. And it's okay because perhaps the problem or issue that they're addressing in that curriculum is incredibly important or is incredibly novel. Or there's it's done in a way that hasn't been done before. So you can still have a very successful publication with assessments and sort of demonstrating like change in perceptions, not necessarily changes in behavior or clinical impact. You can still have a successful publication with Kirkpatrick's level 1 data.
Can I ask a quick question while we're
Yes,
on
of
this
course.
topic?
Mhm.
So I think measuring at the impact level almost seems unfeasible with education, but the behavior change definitely does seem doable. But one of the problems that I foresee is like having the ability to assess a before and after in a behavior change when you're implementing something new. So just like for some of my own experiences, introducing certain communication skills to first year medical students, we don't have a way of assessing how well they can perform those communication skills prior to the session if it's in their first year. So they may not have had an opportunity to be assessed on the behavior. And the assumption is that they wouldn't be doing the behavior until we taught them about it. So I don't see how I can show change, only an end result. Does that make sense?
Yes, it does. And again, this is why educational scholarship is so challenging. It's like really hard to have these kinds of studies, especially with new learners. Like, I don't know that it would necessarily be worth the time or resources to have the students do an OSCE with like no preparation at all, and then have your intervention and then have them do it again. Like then you could really do like a pre and post kind of thing. So that's just harder to do. So you're right. You may trying to think of sort of how you would do it. I think in that sort of sense, in that example, I think you're going to rely a lot on perceptions, probably, right? Do they feel like more confident or comfortable with these skills? You can observe behavior change if you do like a post a post sort of assessment, like let's say you do an OSCE. Another thing that might be helpful is for you to do a follow-up. Sometimes after an educational interventions, they'll do something immediately after, like after the workshop. And then they may repeat it several months down and see like, does it stick? Is it still impactful? To just see if there's like retention of that behavior change. So that's another way to sort of think about it, where you can actually sort of reassess and gather additional data. But you're right. I think a lot of our educational interventions are going to be really hard to demonstrate like true behavior change from the intervention itself. Sometimes you can do it. Again, the communication, the example you gave, I'm sort of having a hard time thinking about how to assess the learners at baseline. But sometimes you can show, just the fact, like, let's say, did they counsel this patient or not, right? Did they offer breast cancer screening or not? And you can actually look at clinical data, like you can see like how many patients were referred for mammograms like prior to and then after the intervention. So there may be other ways like you can sort of measure that. But overall, yeah, it definitely gets challenging the higher up you go on the pyramid. Yes, Lori, I see your hand raised.
Yeah, I'm wondering what people think about this idea. I've played around with it, and it may work for certain kinds of educational activities, but for pre and post, I like to use a qualitative method where you pose the question and ask the students to exhibit it in a 1 or 2 minute video that they upload. and then you do the intervention, you do the lesson, you do the educational process, and then they follow up again with another 1 to 2 minute video that they upload. And so what you are evaluating is the content of those videos pre and post.
Mhm.
So in the case of communication, the question might be, what do you think are the important elements if you're counseling a patient on cancer? And so the student might do a 1 minute video and upload that. So then you do the education, and then they go back and they upload another 1 minute video. But literally, what would be better is if you ask them to give an example of what it looks like to counsel a patient on cancer. They do a 1 minute video example, upload it, educational intervention, and then they do another video. So I've been using that kind of experimenting with that kind of evaluation. Does that fall short of Bloom's taxonomy in any way, or does that work? What do you think about that?
So I guess is the video of them actually doing the counseling and doing the communication, which is can be a skill, right? It can be a
Yes.
skill, right? So then, so that I think you can demonstrate that. And now it reminded me, like, I think, it does take more time and resources, but there are programs that will have like baseline OSCEs. Like they'll have students do it on the first week of medical school and put them in a situation, say, you have to counsel a patient on tobacco cessation, and then they'll use it really as a formative experience, but they may go back to that same OSCE, after delivering their curriculum and see the growth there. So that, I mean, it is possible. Definitely requires more resources, and we know OSCEs are expensive to run. But Laurie,
So
I do think, yeah,
I'm
I
not,
do think.
yeah, I'm not in the medical school. What is an OSTE or an
Oh, sure. So it's
OSCE?
an objective structured clinical exam. It's imagine those like standardized patient encounters where you
Oh, okay.
someone pretending to be a patient, right? So it's a simulated patient encounter experience.
Yeah, so this is not that formal. It's
Mhm.
simply the student using their cell phone to film themselves
Yeah.
doing 1 minute counseling of a patient and then to upload that to a website. But
Yeah.
thank you.
Yes. No, I think that's a great suggestion in terms of how you can actually, collect pre and post data. I'm gonna move along just because I'm keeping my eye on the time. I know Ray is right after me, so let me move this along. So once you've developed those assessments to link up and say, what is the best way to have my learners demonstrate that they've met the objectives? Then you move on to sort of thinking about, okay, well, what's the best way to teach it, right? So if it's going to be knowledge-based information, then I think by all means, lectures may be very effective, Now, a workshop or something a little bit more engaging might be more effective than a lecture, but that's often like a pretty standard way to deliver curriculum. However, if you're really focused on skills development, right, you want them to examine a patient properly, then I think the simulation, maybe more modules are going to be helpful. So you can actually see it and do it, right? Rather than like hearing about it through a lecture. So you're going to pick the right, the best instructional method for to match your learning objectives and to match your ultimate assessments. Again, this might be limited by resources. You may say, wow, I'm doing like skills development and I would love to have like a simulation session where students can practice this and they get observed, but I just don't have the money to make that happen. I don't have the rooms to make that happen. So I'm going to have an online module instead where I show a video. I have a video to sort of demonstrate some of the techniques and skills. So you may be limited by your resources, but you certainly should think about that as you're building out your curriculum. And so then, once you do this, then you're ready to go. Then you're ready to build it out. I don't know if they've spoken already about MedEd Portal and the use of their ESR, and now I can't remember what ESR stands for. It's the report, the Education Summary Report. Yeah. So that is a really nice guide to look at even before you build out your curriculum and implement your curriculum to help guide you and sort of make sure you're following all of the steps. So I just pulled this from our web on the website. This is what the ESR, includes, and you can see this on when you just Google it on MedEd portal. But all of their sort of requirements for their educational summary report really address a lot of these elements of curriculum design and implementation that we've talked about, right? So they want you to identify SMART objectives and write it as such, right? They want you to think about Bloom's taxonomy, to think about how, the extent of your goals, like what you can accomplish. In your abstract, you have to have an introduction, which is really the needs assessment, demonstrating that you've done this needs assessment, that you've looked in the literature. And then in the methods and results section, you're going to sort of just describe the assessments that you've built, what curriculum, you developed, what design you use, like how was the curriculum implemented. It tells you to identify what resources you need and actually include those resources if they're faculty, facilitator, guides, etc. And then in the results section, you're going to describe how you evaluated the curriculum itself. So if you look at that ESR, I really encourage you to do that to help you design your process so that you're not doing this after not looking at it after you've already developed and implemented your curriculum. And then at the end is really the discussion, which is a summary. Okay, so I'm going to close by just showing you an example that was done really beautifully by my academic medicine fellow a few years ago, Zainab Zanani at Stanford. She's a second-year medical student when she completed this. And this was a project that I was talking about in terms of deconstructing ableism. So in the introduction, you can sort of see how she identifies patients with disabilities facing health disparities, and often providers with disabilities as well often face a lot of bias and stigmatism within the healthcare system. So she developed these educational objectives, which you can see on the right here, to really help learners define ableism and disability, recognize or discuss ways it manifests in the medical workplace, identify current barriers in healthcare for patients with disability, identify gaps in resources and support for trainees and healthcare providers and patients living with disabilities, and then generate potential solutions for addressing these gaps. And so what she did was she created two cases, so paper cases, one on a patient with disabilities and one on a provider with disabilities, and sort of short vignettes really with facilitator guides to really facilitate a discussion. Before she went into the cases, there was like a brief PowerPoint presentation that went over some of the sort of information and knowledge, some of like the first learning objective. But the discussion itself was quite rich in terms of giving learners an opportunity to discuss ableism, to identify gaps, to identify potential solutions. And then in terms of sort of their assessment, what they had planned on doing was really like in that Kilpatrick one, sort of level one was really like a pre and post survey about their sort of confidence, in sort of in addressing some of these issues. They also had evaluation pieces just about, where they gave learners the opportunity to just rate the actual educational module itself in terms of its value, perceived value, professional growth contribution, interact, and the design of it. So I think when you're developing your curriculum, think about, again, the assessment. What are you going to do to prove that the learners actually met your learning objectives? And then the evaluation piece, right? You're going to collect feedback from your learners to make sure that the way you did it was like the most effective way to do it. And also to get some feedback for them so that you can use that to revise and refine your educational module. I think that's it. With that, I'm going to end, and I'm happy to take a question or two before I hand it over to Ray. Hi, Ray. Okay, well, thanks so much for your time. And Ray, take it away.